Hi, my name is Dr. Jordan Carcavel, and I'm a Mohs surgeon and cosmetic dermatologist. If you've been diagnosed with skin cancer, your doctor may have recommended Mohs surgery, and you probably have some questions. In this video, we'll walk you through what to expect before, during, and after your procedure with Mohs surgery. So let's get started. So, what is Mohs surgery and why is it used? Mohs surgery is a skin-sparing technique that we use for skin cancers, typically basal cell carcinoma and squamous cell carcinoma. It can be also used for some melanoma. The goal is to remove skin cancer while preserving as much healthy skin as possible. So if you're undergoing Mohs surgery, here's how to prepare. Before the surgery, avoid any unnecessary blood thinning medications. This might include aspirin or ibuprofen or fish oil. If your doctor has asked you to take a daily aspirin, we don't want you to stop that. If you're on any blood thinners for another condition, we also don't want you to stop that. But let us know about them. You want to get a good night's sleep, and you want to eat a normal breakfast. This is not one of those procedures where we have you not eat for 12 to 14 hours prior. So have a breakfast. For the day of your procedure, make sure you wear comfortable clothing. Sometimes these days can be long, so you want to be comfortable for the whole time you're here. Also consider bringing a phone, book, or headphones to pass the time. It can take a few hours to process the tissue, so we want to make sure that you've got something to do. The Mohs surgeon will start by removing a thin piece of skin from the affected area. The tissue is then examined under a microscope to check for cancer cells. If there is residual cancer found, then we'll go back and take another layer. This process is repeated until we know that the area is cancer-free. Local anesthesia is used so that you're awake and you're comfortable. We sometimes may do additional injections because you might be with us longer. It's important to me and your surgeon that you're comfortable during the procedure. We use local anesthesia so that you're comfortable and you're awake during that time. After Mohs surgery, when the tumor is removed, we can close the wound up, or sometimes, less common, we'll leave it open to heal by second intent or heal on its own. You may experience some swelling, tenderness, mild discomfort during that first 24 to 48 hour period, which typically a little bit of Tylenol can help. You want to follow your doctor's instructions so that you know how to take care of your wound and not stress it out too much with exercise or rapid movement so that you can get the best healing. Most patients can resume normal activities right after surgery. However, we do recommend to avoid intense exercise. This will depend on the location that it's treated, but you'll receive guidance after your procedure. Since Mohs surgery only removes the necessary tissue, it often means in a smaller, more acceptable scar. Over time, your skin will heal, and you may be offered some treatment options that will help to optimize your scar, whether that be skincare products or even a potential laser to help reduce redness or help blend in the scar. Overall, Mohs surgery is one of the most effective ways to treat skin cancer. If you have any concerns, it's important to speak with your doctor or your surgeon about any questions that you have before going into it. For me, it's important that my patients feel confident that they're in good hands. So please don't hesitate to consult with us or ask questions prior to the procedure. If you liked this video, please feel free to like and subscribe, and please put any comments or questions below. Thanks so much.